I continued to accumulate more and more HIV patients. I wound up having a reputation in Dayton as being, quote, the AIDS doctor. And I know that a lot of the testing places would wind up referring people to my office because they knew that people were going to get not only individual care, but they were going to get holistic care in terms of they were going to get total primary care and HIV care all in one place. I continued to do that up until 2008. By that time I had like 450 or 500 AIDS patients that I was just following as a solo practitioner. So that's when I went back to the School of Medicine where I graduated from, Wright State, and I went to the family practice department there, and I told them at that time I had 450 to 500 AIDS patients that would follow me anywhere. It would be a great way to introduce medical students to help treat these patients and learn how to treat people with HIV from a primary care perspective. And they said, that's a fantastic idea. Come on in and join us. So I joined the Department of Family Practice at Wright State in 2009, and then just worked with them all the way to the end of 2018 is when I finally retired from seeing patients.
Dr. Robert Brandt, Dayton, Ohio. Hi, my name is Nicholas Wood, and welcome to this episode of How to Invent a Virus, an exploration of HIV/AIDS communication in America told through the 5 W's of journalism: who, what, where, when, and why. In our last episode, Where is HIV?, we touched on the disproportionate impact of HIV on southern U.S. populations and some barriers in access to care. We left off on a discussion of the tendency of the American healthcare system to prioritize treatment over prevention, and some of the implications that houses for our conversation about HIV. Namely that, although successful treatments exist, there is still no cure for HIV, so our strongest defense against it is prevention. So today, I'd like to pull from that conversation a little bit and take a look at a key component of prevention: education. Now, one of the biggest reasons I was interested in pursuing a career in the media, and like the entire motivation behind this podcast, is that I have a passion for education and education on a wide scale. I see education as power, and when it comes to HIV education, there lies so much power. Our bodies are our most personal possessions, and it's incredibly important that we equip ourselves with the knowledge to protect them. That's why today, we're going to be exploring when people receive an education about HIV and some of the benefits of that education. And on top of that, we're also going to highlight ways that you can both treat and prevent HIV. So if you weren't aware before listening to this episode, you can walk away feeling empowered, knowing how to play an active role in maintaining your health. So I'm aware that asking when is HIV is an incredibly vague, kind of confusing question. But my take on it can be expanded to be, when are people learning about HIV? And this is a really important subject to dig into, because, as I mentioned in the very first episode, I was never really given an education on the subject despite being a gay man, which we know is a high-risk group. So, how many other at-risk youth aren't receiving the education they need to keep themselves healthy? Alright, so first of all, I want to begin by discussing some key elements of an HIV prevention education. To know how to prevent contracting a virus, you first need to know how it's transmitted. Luckily, this is something we've covered throughout the series. HIV is transmitted through vaginal and anal fluids, blood, semen, and breast milk, and passed from person to person during vaginal or anal sex, or through sharing injectable drug equipment, as well as from mother to child through childbirth or breastfeeding. So, knowing that, we can build an understanding for how to limit transmission through those means. First of all, if you engage in injection drug use, it's important to always use clean needles and syringes every time you inject drugs to protect yourself from coming into contact with infected blood or to avoid passing HIV to someone else if you're already positive. That's why clean needle programs are so critical when it comes to limiting or preventing an HIV outbreak. For more information on this though, make sure you check out the conversation I had with Dr. Polini in our last episode. The next way to prevent HIV is through condom use during vaginal or anal sex. Both internal and external condoms are very effective in preventing the spread of HIV as well as other STIs, such as gonorrhea and chlamydia, that can increase your risk of contracting HIV through sex. Latex condoms are the best for HIV prevention, but plastic or synthetic condoms work as well for those who have latex allergies. However, be aware that plastic condoms tend to break more easily than latex. Condoms made with natural membranes like lambskin should not be used to prevent HIV or STI transmission. These have small holes in them that don't block HIV and other STIs from entering your body. Also, on a similar note, make sure to always communicate with your partner before having sex. Communication and consent are key to having healthy sex that protects both you and your partner. This also means it's best to avoid having sex when you or your partner are under the influence of drugs or alcohol, which can impair judgment and increase the likelihood of engaging in risky sexual behavior. To prevent transmission from mother to child through childbirth and breastfeeding, if you're HIV positive, make sure you're on a treatment plan and taking your medication as described. HIV treatments called antiretroviral therapy, or ART, can reduce your viral load to the point of being undetectable, which means it also can't be transmitted. This is true for all people who are HIV positive and trying to protect those around them, but in this case, it's what can help lower the risk of transmission to your baby through childbirth. And lastly, one of the best ways to prevent HIV in all of these cases is by taking PrEP, or pre-exposure prophylaxis. In some of my previous conversations throughout the series, you may have heard PrEP mentioned a few times, but if you aren't aware, PrEP helps create a barrier around your body's CD4 cells, those cells that are usually targeted by HIV, and prevents the virus from entering them and replicating itself. Currently, PrEP is offered as a pill that, when taken as prescribed, can reduce your risk of contracting HIV through sex by about 99% and through injection drug use by at least 74%. But of course, as we discussed in our last episode, because of barriers in access to healthcare and other lifestyle factors, PrEP is not necessarily an affordable or realistic option for all people at risk of contracting HIV. However, most insurance plans and state Medicaid programs cover PrEP, and there are many programs that provide PrEP for free or reduced costs. For more information on these programs, make sure you check out the link in the description of this episode. Alright, so that was a pretty quick rundown on how to protect yourself from getting HIV. A lot of that information is included in public health and outreach campaigns in the media, like we talked about with Tina Hoff a few episodes ago. Ideally, though, this kind of education would come at people from all fronts and start at an early age. Again, young people between the ages of 13 and 24 make up 1/5 of all new HIV diagnoses in the US, and this isn't just a coincidence. Sex education curriculum in America is not regulated in the same way from state to state or school to school. It can also be heavily influenced by standards that reinforce the stigma around HIV by characterizing the behaviors linked to transmission as shameful or immoral, thus ostracizing the groups at high risk. People in our society are often hesitant to talk about sex at all, but when it comes to talking about sex with young people, especially young people who are sexual and gender minorities, it gets even more complicated. But the benefits of a comprehensive sexuality education for adolescents are there. Schools that have implemented CSE programs see higher rates of sexual health literacy, which leads to lower rates of STI transmission, sexual violence, and teen pregnancy. School-based CSE programs have also proven incredibly effective in helping increase awareness of HIV and the behaviors associated with transmission and prevention in young people. Yet few states have made this kind of education a priority, and instead opt for abstinence-based programs that teach students that the only 100% effective way to avoid contracting HIV and other STIs is by completely abstaining from sex, which leaves so many gaps in knowledge and other ways to practice safe sex and protect yourself from HIV. Some states are even required to provide only negative information on homosexuality. So to address some of these gaps in knowledge, many areas form community-based outreach groups that focus on providing relevant information attuned to the needs and lifestyles of their community members, on how to protect yourself and others from contracting HIV and other STIs. One such group is Peer Movement Project. Peer Movement Project is a student-based advocacy group based in my own campus at Wright State University, and it provides resources and serves to create awareness of sexual health and decrease substance abuse among university-enrolled African Americans. I sat down with Ashley Browning, the project coordinator for Peer Movement Project, to learn a little bit more about the program and the services they provide. So I guess, first of all, I want to ask a little bit about your background, like where you're from, what you study, what brought you to Wright State, and
I'm from Dayton, Ohio originally. I left in 2008 to go to school at Kentucky State University. And then I later went to school at University of Kentucky for my master's in rehab counseling. I began working at Wright State in 2018 on the peer movement project. We service three local universities, Wright State being one of the universities. And through the peer movement project, we educate, bring awareness about HIV on college campuses, mainly for African American students, 18 to 24. But where it's open to anyone to attend. Also, so we do HIV testing through it, and also we do a 5-week class called Life on Guard, which is more about education of HIV, STIs. So how the program is set up is it is myself and a prevention educator. And then once students take the class, they are able to be peer advocates for the program. So currently we have about maybe 7 at Wright State's campus right now that are student advocates for our program.
What does it mean to you getting to provide services like that to young people, specifically young African American people on those campuses?
I love the project. I think it's a great project. So people can be aware of what exactly HIV is, and also for the high population or high age group, giving the information to prevent them from becoming cystic. I just love the piece of being able to help someone and bring awareness and being able to be an advocate for it.
Peer movement project, and I looked into some of the other work that you've done, and it seems like you really do have a lot of work centered around like communities and building up your communities and bringing communities together. So I just was wondering why that focus on community is so important to you.
When you're in a community, you have to take care of the community that you're in, and when you're in college, this is ultimately your family in a way. It is the community that you live, breathe, and now are surrounded by, these people every day. So let's take care of each other. Let's take care of ourselves, and let's figure out how we can protect ourselves in this community. I think it's very important for anyone who is sexually active.
So are there any ways that you've seen members of your community misrepresented or otherwise excluded from public health campaigns and education campaigns about HIV?
So I think that the target on a lot of HIV campaigns is only MSM, the population. And so that's men who have sex with men. And I think that the population should be more broader and for anybody who is sexually active, especially for women of color, because our rates are higher than anyone else. Of course, we've heard before. It's the gay disease, you're gonna die, all of the things that are false surrounding HIV, or things like don't eat off of somebody who have HIV or, that kind of stuff. And then it just comes from a place of being uneducated about what HIV is. Most definitely, I always see people who don't get tested because they're not gay, quote unquote gay, or they are unaware of how you can contract it. So they just think, well, I'm not shooting needles or I'm not an IV drug user, so I am not at risk for HIV.
After my conversation with Ashley, I also spoke with one of Peer Movement Project's student advocates, Amber Cornist-Bordeneau. Amber is currently a sophomore in Wright State University's College of Business, and she's been a peer advocate with Peer Movement Project for nearly 2 years. And you said you're a peer advocate for a Peer Movement Project.
Yes.
How'd you get involved with that?
First year, they had a booth. We walked up to them, we signed up, they emailed us, gave us text messages, and said, would you like to do this? We also give awareness to HIV. It's a class to basically inform you of all these things and teach you different types of things about HIV, getting tested, safe sex, being safe, being aware. Once we actually took the class, we finished the class, they asked us, y'all are able to be a peer advocate if y'all like to, and I was like, yes, sure, I would love to do it. But I love it. I love talking to people. Some people's not open to it or like look at you like kind of weird when you walk to just talk about like sex and like pass out condoms. Like, we're all adults here. Like, you could either just be like, okay, or like, cool, like, you know what I mean? But people do feel comfortable, so I can't like make them feel like they're not.
Why do you think it's important for people to, for like you as a young person, why do you think it's important for you to also reach out to other young people and have that connection with them and talk about
Because
sex?
sometimes, most of the time, parents don't talk about sexual transmitted disorders or HIV and things like that. They just pretty much just tell you to be safe or just don't have sex, period. A lot of people don't even like, some people have sex for the first time, get something, or just get pregnant from their first time. And so it's important to know that you either have the option of condoms, the option of birth control. Don't let people easily influence you to doing something that you're not 100% okay with. It's okay to say no. Don't feel like you're being pictured, or feel like if you don't do this, then they not gonna like you, or if you don't do this, like they gonna do this or something like that. Don't let nobody have that control or that power over you. I think that's important, just to talk to people like it's okay. It's okay to say no. It's okay to be aware. It's okay to ask these questions. So I think that's what's important.
And it's an organization that's for Black and African American students?
Yes. Any student can actually be a part of the class. They bring strong awareness to African Americans, Black students, because the Black and African American HIV rate and STD rate is like really high.
And why do you think it's important to like have that emphasis?
Me being Black African American, our parents don't talk with us much about things like that. So I don't know. I think it's really important to like just to say it, that we're not bringing awareness to ourselves as much. I feel like we just, all right, cool, it doesn't matter. Or like, just in general, honestly, I feel like people don't take it as serious as they should. They just like do whatever and feel like nothing's going to happen. But like, you really have to pay attention to those things. I know that being a part of a peer advocate, that we do just talk about that a lot.
And then like beyond Wright State, do you think you're going to be involved in any sort of capacity with that similar like?
I'm going to forever empower women, empower the community, help out community service. I really love to be involved with different people, help different people that's less fortunate than me, you know what I mean? Yeah. So like, I feel like it's going, like, even if it's just not like going full throttle towards HIV or STD, I always want to bring awareness to anything that that's happening in the world.
Yeah. And there's that theme of community coming up once again. The issue of HIV and AIDS is one that continues to fall on the shoulders of those in the most impacted communities to educate, uplift, and empower one another. That's our strongest defense against it: preventative education tailored to community interests and lifestyles. At the same time though, no matter how much we try to educate each other, until we find a cure to the virus, people are still going to be living with and potentially transmitting HIV. So on that note, it's important that we quickly touch on treatment. HIV is no longer the death sentence people once thought it was. In the mid-1990s, advancements in treatments for HIV began reaching a point where people who had HIV could begin leading longer, healthier lives. Today, we're at a point where antiretroviral therapy medications can get HIV under control within just 6 months by supporting your body's immune system and helping it respond in a way that limits the virus' abilities to multiply. Again, ART can't rid your body of HIV completely, but when taken as prescribed, it can significantly suppress the viral load. But just like with PrEP and other preventative measures, access to treatments and the ability to stick to them is dependent upon a lot of factors. Dr. Parya Saberi is an associate professor at the Division of Prevention Science in the Department of Medicine at the University of California, San Francisco. Among other things, her area of research includes looking at technology-based strategies like mobile apps, video conference tools, and text messaging to improve ART adherence and engagement in HIV care among youth living with HIV. As part of her research process, Dr. Saberi likes to work alongside young adult populations living with HIV by organizing youth advisory councils to give feedback on the effectiveness of her multidisciplinary approaches to supporting that population's adherence to their treatment regimens. I sat down to speak with her a little bit about her experiences working with young people living with HIV and some of the common factors that play into their ability to stay engaged with treatment.
And I think HIV, like a lot of other social issues like that, there's sort of like, there comes a time where it's like each new generation has like a reintroduction to it, because it's like the generation previous was introduced to it, they've like lived through it and fought for it, and then now the next generation comes in and gets reintroduced. And HIV is something that isn't like commonly even, I wasn't taught at my high school in sex ed, and I don't think a lot of people have a sex education, so it sort of falls on the shoulders of people in the media and in public health to bring about that reintroduction. And I feel like with a lot of your work that I notice is you do try to like toe both of those lines, like bring in the sort of media elements and the health elements to educate the younger generation rather than just, keep it existing in like one academic sphere.
Yeah, and almost becomes a patronizing, like top-down type approach of like, we're the researchers, so we know what's best for you, or like we're the clinicians and we know what's best for you. And that's like very patronizing, and it's very infrequently results in any real change. And I think one thing that you said that I'm like a huge advocate for, not just for research with youth, it's research with anyone, but the very deep connection and involvement of the communities that and having those voices be reflected within the research, I think is absolutely critical and so frequently overlooked with so many types of research. And that's a huge part of my research agenda, to make sure that there's always like a youth advisory panel, even though sometimes it does seem like it takes longer, oftentimes so many other like beautiful things come from it that would have otherwise been overlooked. And that's a huge component of all of my research projects.
You mentioned that you had the youth advisory council. Is that like things like that, or is that how you say you like stay on top of that understanding of HIV from generation to generation, so you can like continue to make effective prevention efforts?
Yeah, that's a really good question. It's a mixed bag approach. Like one of my projects very early on when I was starting my research career was to come up with tech-based approaches to help youth and young adults living with HIV in adhering to their medications, being engaged in care more, and just, eventually having better clinical outcomes. So 2 approaches that I took, one was to create this mobile health app, which is called WISE, W-I-Z. And then the other one was to have more of a video counseling series, kind of like a short therapy session focused on like mental health, substance use, like, and like very specific topics like relationships, families of choice, like disclosures. And then once we did the actual pilot studies for both, a lot of folks that were in, like there were some folks that were in both studies, and they started saying, well, we really like both of them, not just one or the other, because like one of them helped me with like talking about mental health type stuff, and then the other one helped me like organize my meds and like have like, because there's like a section of like a community section where you could chat with other youth living with HIV. Like that was more like a social, like targeting social isolation type barriers. So like they were complementary to each other as opposed to like one versus the other. So these are like the ways that it comes about. It's there isn't one single path. It's kind of like one thing leads to the other, like these new discoveries as it's happening.
I think it's important to like always be trying to find new ways to capture people's attention, so that way they can keep always furthering their knowledge on things, rather than just, you need to go down one straight narrow path for everything all the time. But with young people, have you noticed that being an issue, their like interest or like care about the topic of HIV?
That's a really good question. Probably when I first started because we didn't have a lot of good medicine at that point, I feel like a lot of the conversation was very much almost like a reactionary of like, let's just keep people alive. And I think that the discussion now is, well, now we have all these great medicine and very little toxicity. Like, people are living longer, healthier lives. So now the discussion is more around quality of life, of like, let's now focus on mental health. Let's now focus on all the disparities, all the stigma, all the, everything else. So I feel like, all those questions were always there, but really now I think more focus is on quality of life versus just let's keep you alive. Yeah, I do think that definitely is a really important issue that younger folks are probably picking up on, that if it's not panic mode, then maybe it's not as important. One thing that, though, I've still been very surprised by is that there's still a lot of discussion around like shame and stigma, even within younger folks, which is, I thought, was one of the most interesting things or surprising things that I found, that I would have thought that there would be a lot of difference between, a current younger generation versus like decades ago of people who were living with HIV. And yet that is still a topic that comes up quite frequently, is, just this fear of disclosure and stigma around their HIV status. So on one hand, yes, I think there's probably less education because there's less panic about it. And as a result, there's less focus on prevention. On the other hand, the issues around stigma and shame around disclosure have also not been dealt with. So those are still there in society, kind of, as they have been for decades.
And I know a lot of your work seems to focus on like supporting people's like continued adherence to like ART and PrEP. And we've talked a lot about mental health. And what other factors would you say you see most commonly like play a role in influencing people's adherence to PrEP and ART?
There's like, 1,000,001 responses for this question. I think like mental health is probably, in the top 10. Stigma is probably way up there as well, of like, even like a self perceived stigma of like, if I'm taking HIV meds, it's going to remind me that I have HIV. So I think stigma also is a big component of it. Substance use is huge. I think probably for youth and young adults specifically, the things that I've heard a lot, in addition to mental health, substance use, stigma, which I think is like probably like top on the list, is also just like a very chaotic, busy lifestyle of, just having a very difficult time working a daily med into a daily routine. On that same topic, one thing from a lot of my PrEP studies that we noticed was that this question of like, well, why do young people like stop, PrEP more than older, an older age group? And one of the things that came up a lot was like not even knowing how the healthcare system works, and really just kind of like needing someone to hold their hand. And I think that right there summarizes what I hear all the time from research participants is that ability of healthcare or like, current services to be flexible, is flexibility, and that tailoring component, I think, is probably like the number one thing that I think I've heard from both prevention and treatment studies with youth and young adults. That, the one size doesn't fit all. And that's actually, I think, probably one of the biggest flaws of Western medicine specifically, but current modern Western medicine. And there was from the beginning, very little public input specifically related to communities that were most impacted. And so a lot of, the public health messaging kind of fell flat because it wasn't very well focused and tailored to those communities that needed it the most.
When it comes to treatment and prevention, The earlier we can educate people on how to maintain good health, the earlier they can begin to help build habits that will help them maintain a healthy life for years to come. Further, if we're more proactive in establishing the foundations of a solid prevention education, we can limit the presence of HIV in the lives of future generations. Of course, the factors that lend to someone being at an increased risk of contracting HIV are often out of their hands, as is their ability to access necessary care and prevention options. So, when discussing prevention and treatment education, it's important to keep in mind that the conversation doesn't begin and end there. It extends into many systems and institutions in the US that also need to be examined and made accountable for the ways in which they create barriers to care. Prevention and treatment are simply the most tangible ways we can all take agency over our bodies and our health as the fight for systemic change continues. So, when is HIV? Well, it's not in the past, it's still here now. But we have the power to support, uplift, encourage, and educate one another to stop it from becoming an issue in the future as well. But more on that in the next episode. Once again, I'm Nicholas Wood with Wright State University. I want to give a special thank you to Dr. Robert Brandt, Ashley Browning, Amber Cornist-Bordeneau, and Dr. Parya Saberi for speaking with me for this episode, and to Dr. Marie Thompson for her advisory support in the creation of this podcast. Once again, for more information on HIV resources in your community, such as testing, treatment, services, and prevention options, click the link tree in the description of this episode. Thank you for listening to this episode of How to Invent a Virus.